Good evening and welcome to the second webinar in the series for the preparation for practice. Before we begin, Rax and I would like to acknowledge the traditional owners of country throughout Australia and recognise their continuing connection to land, waters and community. We pay our respects to them and their cultures and to elders both past and present. So tonight, we've got a couple of speakers speaking on the topic of building a practice administration team and medical marketing and promotion. And our speakers will be Emily Elst from Hoxton and Chris Lads from MIGA. Now, before we begin, just some basic housekeeping as per last week. Please use the chat buttons to type questions that we'll collate and ask the speakers at the end of the presentation. Once again, I do not need to tell you where the bathrooms are because you know where everything is in terms of housekeeping. So without further ado, I'm going to introduce our first speaker, which will be Emily Elst from Hoxton. Welcome, Emily.
Hi, Patrick. Thanks for that. So I'm here today to talk about building a practice administration team. So I'll just share that for everybody. So I'm from Hoxton MPM, which is Hoxton Medical Practice Management. I'm the General Manager of Services, and we at Hoxton have a range of different services that we provide, which includes traditional practice management or management advisory services, virtual reception and administration services, which we'll talk about a little bit today, billing services for your inpatient billing, transcription, a lot of the back office work, bookkeeping, payroll, for example. And we also have a practice startup service for new doctors starting, just to give you a bit of context about where I'm coming from. So you're all here today because you want to practice surgery, you want to get into private practice, you want to basically run a small business where you can see patients and make a reasonable living. And I expect that a number of you are probably a little bit worried or apprehensive about what it might mean to become a small business owner. It's not something they teach you in medical school. There's a whole different skill set and knowledge and expertise that comes with being a business owner, and it can be a little intimidating to move into that space. At Hoxton, we work with more than 350 doctors. Common is they've all been where you are at some point in time. So they have all been in the same situation, wondering how they're going to pull this off. And you're all very lucky that you've taken the approach of gathering this information. You've chosen something like this Prep for Practice to get some expert advice, get some different options, and plan and prepare for what you're going to do. Of the hundreds of doctors that we've helped to start practice, there is no one single solution for everybody. So for all of you, it's going to look a little bit different in terms of how you're going to do this. So today we're focusing on the administration side of your business. And in that, you are certainly the doctor, which is a core part of your practice. That's what it's all about. But you're also the manager. And so you hold the ultimate responsibility for the management of the practice. Whoever you hire, whoever your practice manager or business manager might be, ultimately it's your business, and that final responsibility sits with you. You will need support staff of some kind, and really they can be whoever you decide. So it can be anyone doing anything. A lot of people might utilise family, husband, wives, cousin, nephews. Potentially that's okay if they are the right person to support you, if they've got the right skill set. And if we think about that, you know, quality staff does really make a quality practice. So if you're employing people who don't necessarily have the skills that you need, your practice will suffer no matter how good you are as a doctor. So you really want to get good quality people in there. But even the best people are going to require management. You should also, in this day and age, be thinking about your staff turnover. That traditional method of people staying for 10 years and 20 years and retiring with the doctor is not necessarily the reality that we live in anymore. And 18 months is a reasonable time to keep a staff member at this point in time. So you want to hire good people, but don't expect them to stay with you until everything is over. You need to have some processes and systems in place and understand your practice well enough that you'll be okay when they do change. You can offload a lot of the tasks, you can delegate a lot of the things that need to happen in your practice, but again, that responsibility comes back to you. So you need to have a bit of an awareness about how some of these things are working. And really importantly, you need to be familiar with the employment law that governs how you engage staff. So some of the things that you need to know as a basis for that include getting familiar with the Health Professionals and Support Service Award and also with the National Employment Standards. So anyone that you hire, whatever basis that's on, is going to be covered for various parts of their employment under these agreements, which are a minimum obligation that you have to provide to your employees. And you also need to think about whether they're going to be casual or permanent staff. What are you going to actually pay them? What sort of conditions do you offer them? Do you need to be set up for payroll tax? Do you have policies and procedures in place? So there's a few things that you need to think about and establish before you start hiring people. It's really important that you make sure you put yourself in a position where you are going to be compliant as an employer. There's a lot of risk if you don't. So if we look at the second set of staff rules, this is some of the more specific things that you need to have. You need to have a compliant staff contract. It's very common that people will start someone up, particularly if it turns out it is someone that they know, and not necessarily do the paperwork. And down the track, if you have any issues with their employment, missing that contract could cause you a lot of issue. You also need to make sure your staff have a position description. It seems really straightforward. I want a medical receptionist, I want a practice manager, they should know what to do. They don't. They may think they do, but it may not be the same thing that you think a medical receptionist or a practice manager should do. So a position description is really important for you to understand what you require from your staff and for them to know what their expectations are. And it will be something that you refer back to during the course of their employment. That may be as part of performance management, or it just may be as part of their ongoing development. You do also need a policy and procedure manual. Now, for specialists and surgeons, it may not need to be as detailed as perhaps a general practice that needs to go through, jump through a lot more hoops to be compliant, but you need to have something on some of the key metrics that you have around your practice. And that can be simple things like presentation, passwords, all of those kind of basic policies, but also specific things that might be related to how you want your patients handled, how patient data is monitored, and so forth. You need to also have a professional payroll system. You can't just pay people and not give them copies of their pay slips, not set them up for the single touch payroll system. These things are all requirements now. And wage theft is now a crime, and particularly so in Victoria. Just recently, in the last couple of weeks, they've passed new laws around that in Victoria, which are even stricter than we have for our federal laws, which give significant disincentives to employers who even accidentally underpay someone and can be liable for, significant amounts of money and potentially other criminal issues. And you also, again, coming back to this idea of you having that final responsibility of the management of your practice, you do need to be aware of the induction and training resources that your new staff are going to be exposed to. Even if you have a manager in place that's looking after all of those sorts of things, you need to make sure that it aligns with your vision for the practice and your values. And so we then come to the question of whether you need a practice manager. So traditionally in medical practice, the practice manager often is just the oldest secretary. She's been around for the longest, or she's been in the industry for a long time. doesn't necessarily have any management skills, but you know, she might even just be the only secretary that's sitting there, and it feels important to say, I've got a practice manager, or talk to my practice manager, who just happens to be the one person that I hire. If you actually need a practice manager, these are the sorts of things that your practice manager should be delivering for you. So you need someone who's going to add a strategic perspective into your practice. They're going to help you drive and grow and make a better practice for you and your patients. Someone who's got some financial literacy, they can report on the finances, they can help to evaluate and understand the finances and what that information means. Definitely need someone who's familiar with HR rules. If you're hiring people, HR is going to become a huge part of your life, and a practice manager who's very up to date and experienced with managing people and understanding human resources will be really valuable. You want someone who's got industry knowledge, because that is quite different industry to industry in terms of some of the things that you're going to need to know. And you definitely want someone who's got IT capabilities, a good knowledge of IT, and also a good capacity to pick up and understand IT and how different systems interact with each other. And we'll look at that a little bit further later. So hiring a practice manager, generally the first thing we do is we put an ad up and, you know, cross our fingers and hope for the best. If you're very lucky, you'll get an excellent practice manager who's going to look after your practice. They're going to build your practice, help you develop a really good reputation, connect with your referrers, build your patient base. If you're not so lucky, you may get someone who looks great on paper, possibly interviews really well, but actually in the real world application isn't maybe the best for building your practice. Now, do you need a practice manager? So if you're doing the practice management role, then you don't need a practice manager, you need a good secretary. So if we go back to the practice management role, that's the person who's providing the strategy for your business, or at least a good insight into the strategy for your business, the person who has that financial oversight and reporting of the business, the person with the IT nous that you require, and the person who's got the HR skills and oversight. If you're going to take on a lot of that, then perhaps you don't need a practice manager. Perhaps you just need a good secretary. And a good secretary is, unfortunately, can be hard to find, but these are some of the sort of skills and qualifications that you should be thinking about when you're looking for that person. Customer service and patient empathy is really important. Someone who's proficient with computers, someone who's comfortable on the telephone. You want someone with good time management, someone who's worked in an office and administrative environment before. Ideally, medical business knowledge, although you don't have to have someone with medical business knowledge. If they come with everything else and they're adaptable, they can learn the medical industry, as long as you've got the time and the patience and the incentive to teach them those sorts of things. They can come with a lot of really good service and admin skills that are really valuable. And communication obviously is key, particularly if you've got a small team. It's really important that you can rely on that communication to you, to each other, and also to your patients and the people contacting the practice. Finding staff. Before you go out and start looking for staff, you need to determine what sort of gaps you have in your practice, or your vision for your practice if it hasn't started as yet, and how those staff are going to fill those gaps for you. So what are the needs and goals of your business? What sort of hours do you actually need someone to work? Don't just put someone in there full time when you're doing 2 sessions a week just because that seems like a good idea. What sort of tasks are you going to need them to perform? So have a bit of understanding of specifically the tasks you want them to do, and what results do you want from employing those staff for your business. And that's going to help you to determine the personal skills and attributes that are going to be really valuable for you. And then what's it going to cost? So this breakdown here is looking at someone at $25 per hour, which really is probably the base that you're going to start up with anyone. You're not likely to get anyone who's not very, very junior under that. So $25 per hour sounds straightforward. That's 50 grand a year. But actually, once you start employing people, there's a whole lot of extra costs added to that you need to consider. You've got your superannuation, your coverage for personal leave, annual leave, potentially leave loading, paying out the public holidays, you need to start accumulating long service leave. You do need to train and supervise these people. You know, even if they come with experience, you do need to have some responsibility to maintain that development. Their payroll, the advertising to get someone in, the time it takes to interview, work cover, etc. So just looking at some of those basic costs, we're estimating that your full-time person at $25 per hour is going to be around 74 grand a year, 74 and a half. So these are some of the extra things you need to consider. Your other option is to outsource. So it's 2020. We're all here remotely communicating with each other in this virtual space that we're on right now. There's virtual administration. So these sorts of things weren't available to your predecessors. They may not have been something that your mentor or colleagues had access to, but they are definitely available to you now. And these virtual administration services or remote secretarial services are specialised in the medical industry. They're not all specialised, obviously. You can also just go and get a virtual receptionist answering your phone who does it for a lawyer over here and a doctor over here and somebody else over there. But you can definitely get people who are specialised in the industry that understand how a surgical practice works. Your virtual administration is very scalable. You've got expert people in there. It's contracted, it's clear, and you don't require any business experience to use it or any need for any of the HR sort of things that I've spoken about before. You don't need to know about the national employment standards. You don't need to write up contracts that are approved by lawyers or do any of this. You just need a contract with a good service provider. Compare those sorts of costs. So we looked at the costs of a full-time equivalent at 74 grand per year. So an example of outsourcing, if we break that down into sections, so surgical billings, for example, you can get full service billings from someone like Hoxton at 3%. There's other companies out there that will have it at different price points. And that for your surgical billings could be around, say, 6 grand a year. This is based on a surgeon working 3 consulting sessions a week. So you can have your phones answered Monday to Friday, 9 to 5 for about 35 grand a year. Theatre list management, looking after all of the coordination of the hospitals, the anaesthetists, confirming with the patients, doing your informed financial consent, all of those things, 4.5 grand. Front desk, we've put in here an example using a part-timer. So if you were to get someone on a fixed part-time contract to cover those 3 sessions a week, it's around 16 grand. But actually, for a lot of you, you'll probably get that as part of your rental initially, if you're not setting up your own rooms, if you're using consulting suite out of the hospital or potentially from a colleague. A lot of the time, the rental for the consulting space is going to cover a meet and greet person, which is really all you need. Someone who's going to say hello to your patients, potentially collect payment, although these days with options like MediPass, you don't even need them collecting payment at the front desk. And then we've put bookkeeping in there as well at around 1,500. So if you outsourced all these pieces of what your secretary might do, that's looking at around 63 grand a year. So we can see there's a definite potential for savings for you with outsourcing either all of your administration, except for having someone at the front desk when you're there, or parts of it. You might just reduce the time that you're employing someone rather than a full-time equivalent and get parts of that done by somebody else. Again, there's no one perfect answer for everybody. This is something that's going to be, there's going to be a slightly different solution that fits best for each of you. Some of those benefits around outsourcing, it reduces your overhead, it lets you control your costs. From a labour perspective, it's very cost effective compared to your own employment of people. You save a lot of time, you increase the efficiency of your practice, there's continuity with the business, you don't have to worry about people calling in sick or going on leave or any of that other sort of thing that you have with your own staff. Risk management is built in and you can just focus on the business growth without having to be quite so focused on the human resources requirements that you have as a small business owner. So expertise can be bought. And this will cover in a lot of areas. It's going to save you time, money and hassle. There's options for things like practice management, virtual administration, billings can all be outsourced, transcription can be outsourced. There's apps that you can dictate into, and with things like VoiceBox, have that go straight into your straight to your doctors and straight into your software. Bookkeeping and payroll can be outsourced. There's things like Tanda that give you electronic rostering and timesheet systems so that you're completely compliant with that. You can have reward rules set up in there. And then in addition to all these sort of administrative areas, you also want to outsource things that probably seem obvious, but are another form of outsourcing, which is your legal requirements to your lawyer, your finances to your accountant, and your IT to an IT provider. Now, I mentioned the IT provider because obviously we all, we're familiar with some of the changes happening in the medical software space now. There's a lot of cloud-based options and things that seem really easy, but IT is actually a very complex thing in your practice, and this just gives you a little bit of an idea about some of the things that you need to think about and choose with your IT that all connect together, and they include your medical software. They also include different forms of communication, patient engagement platforms, ways to get in your pathology, get your payments through, communicate with your doctors. And the key to all of that is having an IT provider. It's probably not someone that you're going to recruit for your practice. It's probably something you're going to outsource, but I do think that's something you need to be thinking about. Well, it's not something we're focused on particularly today. Your admin team is going to need to have a good knowledge of these systems, be able to do some basic troubleshooting with these systems, understand how they connect, but you're also going to want an IT person to give you that little bit of extra expertise in the event that anything needs a little bit more support. So I just wanted to finish up with a case study, which is a case study from a particular surgeon that we helped. I mentioned earlier that we help people to set up private practice. We also go into existing practices that have had some problems and have not been very successful on their own and help them get back on track. So in this case, the surgeon had been running their practice for 3 years. They were a solo private practice practitioner in a private hospital, did a 1 in 4 roster with ED cover. They had cloud-based software, and they did, their staff did all their billings for them. We found when we went in there and did a gap analysis that they had non-compliant employment contracts, no position descriptions, they weren't providing pay slips, their dictation was 7 weeks behind, which is terrible because that's from a marketing perspective, which you'll talk about later, the way that you're going to connect with your referring doctors and build your reputation with your referring doctors, and B, obviously the clinical care potential impact for those patients. And their billings were at least a month behind. There was more than 25 grand that had been rejected and not followed up, and at least $75,000 that wasn't reconciled at all. So who knew if it had been paid or what state it was in? So it was a bit of a mess. A pretty common scenario though. This is not unusual to see when we have doctors who, have gone and done this on their own. Again, it's not something that you get trained to do in medical school, so it is quite challenging, and you're very dependent on that person that you hire into the practice. So in this case, that person was a lovely, friendly secretary who worked 40 hours a week, who identified herself as the practice manager, really had no managerial skills, wasn't adding any business management nous into the practice, but she was the only person there. So therefore, she was the practice manager. I've used the employment costs here of the $25 per hour scenario of $74,000, but in this scenario, she was actually paid a little defensively and certainly higher than that rate. So the cost really was bigger than this, but just giving us a base example. And we compare that to the scenario of outsourcing some of those things. So starting to wind back some of what that secretary was doing and outsourcing the inpatient billings where it was, getting taken care of. We weren't having to worry about things not getting reconciled or followed up, or being behind, getting the phones answered, getting the theatre list management sorted, having someone on site. In this case, we actually did have a part-timer physically there, and adding in some bookkeeping. And on that basis, in this scenario, we've saved over 10 grand, and in reality, a little bit more. So with this scenario, the surgeon then doesn't have to worry about the employment or HR hassles that they had previously. All the work is contracted and up to date. There's service level agreements on how things are done. So there's no scenarios where things are going to be 7 weeks behind. They save money and they get to concentrate on seeing their patients and not hassling about the business side of things. And, you know, potentially there might be parts of the business that you enjoy doing, like the marketing that you're going to talk about, you know, shortly after this. Maybe if you don't have as much energy focused on HR and you perhaps have a combination of your own staff and outsource, or you just outsource everything, you can focus on things that you find fun. And if you enjoy marketing or you enjoy networking with your referring doctors, those are potentially things you can do. Or maybe you just want to see patients and focus on the clinical work that you do. One of the benefits to outsourcing is obviously giving you a bit more of that freedom. But again, there's no single answer. Everyone's going to be different. Some people are going to find a combination works well, or one complete solution to the other works well. This is where you need to start with thinking about your business needs and goals, first of all, and what you're wanting to achieve, and then work out which options are going to best help you get there. So you're the medical expert. There are people like Hoxton who are expert in other areas that are going to benefit you. For us, that's practice management. It's your business. It's your practice. You need to own that. You have the responsibility for that and make the choices that are going to give you the best chance of success. Think about what those choices are, and this is a great place to start here at the Preparation for Practice event. There's lots of different experts talking about different topics that are going to be really valuable to you, and it's really great to see you here. I wish a lot of the doctors we work with had an opportunity for something like this when they started. Take all of those things on board. Some things will resonate with you, other things not so much, but just keep in mind what your goals are for your business and your practice to help you find the right solutions. And talk to experts, you know, and that might be experts that you find here at for Practice. It might be other experts out in the world, but your training, your skills is in being doctors. It's the clinical side of things that you do, and certainly when I go to the doctor, I want them to have that kind of focus. You don't need to learn how to do everything else yourself. There's a lot of experts out there that can help you with a lot of different areas of your business. Find them, talk to a few of them, get different ideas, get different opportunities, and figure out what's going to work best for you. If you would like to talk to Hoxton, to myself or David, we do offer free 30-minute consultations. You can access those via our website, hoxtonmpm.com.au. Pick a time that suits you and register. I've also got our contact details up there on the screen. So that's myself, Emily, and Dr. David Williams, who's the Managing Director, who can both make time for a 30-minute consult. There's no obligation, but just gives you a chance to talk to one of the experts, and in this case our expertise is in the medical practice management space, and we work with lots of other people, including people like MIGA, who's going to speak to you next, and a lot of the software providers, people who work in marketing and websites and so forth. So we'd be more than happy to talk about your practice and your situation, give you some ideas, see if we're a good fit, or at least give you something to think about and compare when you're working out what you want to do. All right, so I'm going to stop sharing my screen now.
Thanks very much, Emily.
Thank you.
And next, I'd like to invite our second speaker for this evening, Chris Lads from MIGA, to share his perspectives on practice administration and medical marketing. Take it away, Chris.
Thanks, Marilyn. So, look, unfortunately, you're not going to get a marketing 101 from us because we're a medical indemnity insurer. So perhaps Emily might have been a bit generous in what I was going to talk about, but that's all fine. So, being in medical indemnity insurer, we just want to talk about what you need to be aware of if you're venturing out there into private practice land, because there are aware of when opening up a practice, and also how you're going to purport yourself out there to the general public. So there are different sections and areas and organisations that will be monitoring, but also that you've got to be aware of when it comes to marketing yourself and your practice. So there are national laws out there that are applicable, and this is one of the areas you've got to be aware of. So briefly, the guidelines that are applicable here are that you can't use testimonials on your website. And I was talking to the guys that were preparing for the meeting today, and I actually saw a practice just the other day that actually was still using testimonials on their website. So just be aware that it's not a done thing. You can't actually do that. You can't offer discounts and gifts. Again, this is probably more what we see in sort of cosmetic practices, where they offer certain aspects to encourage the patients to come back for potential procedures that aren't warranted. You can also make sure that your information that you provide is clear and concise and not deceptive in what you provide. Again, these may be things that seem fairly logical to you, but unfortunately, these are the sort of things that we do encounter in the things when we see on websites, etc. So please just make sure you're aware of these particular national laws. The national organisation, the ACCC, now that you are looking to go into private practice, you are obviously considered to be a business, not just a medical professional. So you are still guided by the ACCC, who's the watchdog with these areas, and particular things that they're looking at, that you make sure that you clearly indicate your appropriate expertise and credentials. List that the right set does have different hospitals. So very, very important that you make sure you make those clear on anything that you put out into the market. These are very similar to the national laws, as I said. So make sure you treat patients fairly, but that you also make sure that you don't cause detriment to other parties. And that's not necessarily just patients. That can also be your peers and colleagues as well. Our good friend AHPRA, again, another organisation that will be watching what goes on, and I'll be sharing some case studies a little bit later, and which does show that they are out there making sure that medical practitioners are doing the right thing by their patients. So again, these things are probably reiterated in some of the earlier slides I provided to you. I think one of the important ones here is probably that last point there, that you provide facts rather than claims that what you do may be better than others. Now that may well be true, but unfortunately you can't say those sorts of aspects on your website or other sorts of areas that you promote yourself. As you'd expect, there are consequences of providing this information. Fines and penalties would be applied both to yourself, and if you're running a via business, fines to the business as well. Damages can be payable if it's seen that what you've provided has caused an actual damage to a patient. Injunctions, refunds, and also obviously corrective advertising may be warranted as well. So just be aware that it may not just be a slap on the wrist that you get. There may be other areas that that might be put upon you. So what you think of may be ways of promoting yourself may be innocuous, and let me by saying is that it is very, very important that you do market yourself, because you are in a competitive market now. So I'm not saying that you shouldn't do it, just making sure that you're aware of areas of concern that may be out there. So in this particular case study, as it suggests there, a GP went on to a talk show and just discussed the services that it provided. And as I mentioned to you earlier on, AHPRA did actually get wind of that. Now, whether that's from them actually watching the talk show or perhaps one of the peers suggesting to AHPRA that this is what's occurred, then they sent a letter to the practitioner, and they just wanted to make sure what the information that was provided was reasonable. So despite the threat of a monetary fine, in this case, it didn't go down that path, but you don't want to put yourself in this situation where you're getting a letter from APRA. For those who have been lucky enough not to get one, it can be quite daunting to receive a letter from APRA. And some of these matters are not necessarily resolved overnight. So it can weigh down on you and potentially affect your practice as well. So in this case, it was just a warning to the doctor. So the tip there, your medical defence organisation, whoever it may be, should be one of those advisors that Emily was referring to earlier on, that you should seek counsel from. Yes, we are an insurer, but a lot of what we do is provide medico-legal advice and assistance. So call us. It's not going to reflect adversely. In fact, we probably prefer that. So we get ahead of the game, so we don't get these letters from APRA, as indicated in this particular case study. So second case study, and by the way, these are real case studies. We use real case studies and not made up. So these actually have happened, and we've received them in our claims team. So a cosmetic practitioner on his website indicated that he was RACS trained surgeon, and that's what he purported his credentials were on his website. Obviously, APRA can very easily ascertain that sort of confirmation, and the doctor received a letter from APRA with regards to that. Again, no penalty was applied. It was just a warning to the practitioner and to change the appropriate credentials on their website. So obviously one of the main areas that you're likely to look towards marketing yourself is obviously the modern way now with websites as well as social media. Obviously it's a very, very good way to market yourself, and you can see the sorts of things here where patients really do rely on good old Dr. Google these days to find out further information about a practitioner and what they propose. So again, a presence on the web is obviously highly important, but we just need to make sure of what we propose and put out there is reasonable, and also it's under your control. And I'll talk a little bit more about the social media side a little bit later on. So from a regulatory perspective, what is okay? So build reputation, provide information to potential patients. You can certainly connect with other colleagues via the internet and different ways of providing further information for patients that are out there. And you can make yourself heard or make yourself known on the web, obviously. Again, this might be repetitive, and these might seem obvious, but again, these are some of the areas of concern that we've encountered. And doctors have actually called up because they've had actually issues with regards to these exact sorts of things. So, as I said, they are fairly obvious, but it's certainly something to be aware of with regards to what you should and shouldn't do. So, other than areas that are under your control, there are obviously lots and lots of different sites now that doctors can have access to and patients can have access to. Now, with regards to these, providing or having a section on your website for patient comments, you can do that, but obviously that could be fraught with danger, and that's something that needs to be monitored and make sure that you're across any sorts of potential issues that may arise there. Outside websites, again, these aren't under your control, but we have had cases where some of the websites that are out there, we've actually been able to remove some adverse comments that have been made on these websites. So your Negligence insurer may or may not provide that sort of cover, but it's something you may want to consider when you're choosing a medical defence organisation. So when you are looking at these putting up comments, make sure that you take in consideration privacy requirements that are applicable. So when it comes to potentially responding to negative comments, there is the adage there is let sleeping dogs lie. It may be in the best interest just not to make any sort of commentary and come back at the patient. First thing I wouldn't do is I certainly wouldn't be making comments directly back on that particular website because that's obviously potentially to pile in as well and add their 20 cents worth, whatever the case may be. So the best way to manage this would be to make direct contact with the patient because they've obviously have an issue and see if that can be resolved offline, as I mentioned. For those who, those comments made on outside websites, as I mentioned, that there are some rules and regulations where the actual policy says that you can actually get those remarks removed. When push comes to shove, defamation proceedings can be instituted, but that could be a long, drawn-out, costly process. So I would certainly caution that aspect to it if you feel that aggrieved. So when you are setting up websites and have commentary or other things, so make sure that patient privacy is paramount on the website. Security and access to information. So again, if you're one person operation there and you've got one person in control of it, then that can be have particular issues. If you've got multi-staff there, then you may want to restrict access to the website and what can be put up on the website. Ensure as part of your practice policy for staff that you have protocols and rules in place as to what they can and can't do. So what can you do to minimise this? Have a process where the patient doesn't feel they need to go online to put a complaint in. Have a process where you can have a satisfaction survey so the patients can. So send out an email after you've consulted them or performed surgery on them, see how satisfied they are with your services. There's a way of improving yourself, improving your patient relations, because statistically, if the patient likes you, then they're less likely to claim against you. The website, you've got to be involved in the setup of it and make sure it's a living document, that it is reviewed. I'm constantly on websites where I've seen some marketing material that put up there since 2008, and that's the last time it's been posted. So if you're going to have these sorts of forums on there, then make sure that, I guess, it's updated because patients will look at those sorts of things. So at the moment, you may be considering opening your own practice, or you may be looking to go in to practice with colleagues. This changes the dynamic and how indemnity policies react to those circumstances. So a fairly basic sort of scenario here. We've got two owners, and you may have a couple of other doctors working there and potentially some allied health staff or practitioners in the practice as well. So as you can see, they're all linked, and you as an owner have responsibility for the way that practice is managed. You can't just say that Dr. X, that's that doctor's patient. I don't have any responsibility for that doctor's patient. Quite right, they may be treating the patient, but they might be utilising your staff, and therefore you are also responsible for the actions of your staff. So that doctor's patient may sue or may come back to the practice for the issues that they have. It may be a breach of privacy, as an example, where Dr. X is obviously not necessarily responsible for the breach of privacy from the staff member that you engaged. So just keep that sort of scenario in mind, and I just want to quickly go through what medical negligence is. So there has to be a duty of care. So you have a duty of care to your patients, as you know. Again, that duty of care would also be applicable to the staff members that you engage as well. There has to be a breach of the duty of care. And as a result of that, there has to be damages. So all these three things have to align before a patient's entitled to any sort of compensation or payment. So be mindful of that duty of care and how this is potentially extending out now, where you are utilising other staff or working with other medical practitioners or allied health practitioners within your practice. So there is a concept with regards to this duty of care. And again, this relates back again to the staff in your practice. So it's a third-party responsibility where you may be vicariously liable for the actions of your staff or other doctors within the practice. So you can't just say that you don't have a potential exposure there. So with regards to that, if you are now engaging other people within the practice, of course, your professional indemnity insurance for yourself is highly unlikely to cover a practice scenario, just a simple one that I showed you a bit earlier on. So there may be the need there for a professional indemnity insurance cover for the practice. And other than just covering those scenarios of breach of privacy or other sorts of areas, the cover can extend to also including those items listed there as well. But also mention that it can also extend to including employment-related matters. So if you're having issues with a staff member, this policy also can also include cover for medical legal advice. So you're now in a business scenario, so you may need advice with regards to situations. So probably the most common one, obviously probably note at the moment, very topical, is the COVID scenario. Practice has changed in the current environment. We're moving to telehealth. So you should be relying on information and advice from your medical defence organisation to make sure that you're practicing safe and that your practice is practicing safe as well. So utilise, again, your medical defence organisation as a partner in your business. So just finishing up now, make sure that you have an ongoing review of your advertising, speak to your medical defence organisation if need be. Social media use, again, this can be an area of concern for you, and particularly on providing reviews or feedback from patients on your website. Make sure the information provided is useful, and you insure against the losses as well. So again, just finishing up now, with regards to information, all the insurers have free information on their websites where you can get access to information and fact sheets that can help you set up your practice, and also on an ongoing basis as well. So I would encourage you to look at those websites and get some guidance from there. Thank you.
Thanks very much, Chris. So that concludes the formal presentations for today's webinar. Next, Patrick Lowe, my co-moderator, and myself would like to share some of our perspectives on some of the important aspects that both Emily and Chris have touched on with regards to setting up your own private practice. And following that, we're going to have Emily and Chris back to answer some of the questions that have been sent in from the audience about various aspects. So I just want to kick off by saying that I'm a urologist, and I had to go through this process which you're all going to embark on about setting up my own private practice. And the advice that I can give you is that in terms of selecting your administration staff, really to echo what Emily has said, and that is that you need to select the appropriate staff and take the time to do this. And if you're going to do this yourself, then be prepared to put in the time and the effort. And if you feel that you're time poor, then you're probably best to outsource this through an agency. And that way you know that you're actually getting the right people for your practice. And it's also going to help you to cut down on a lot of stress. The other thing that's really important from my perspective looking back now is that when you are selecting the staff that are going to run your office or manage your practice, it's important, I think, to advertise widely so that you're actually attracting the most experienced applicants. You've got to be prepared to pay people appropriately. And I think remuneration is a really important factor, not only in attracting valuable staff, but also in retaining the staff that you find are invaluable to you, to the running of your practice. So, you know, don't shortchange people in terms of how you pay them and how much you pay them. And often be prepared to offer them, you know, a salary that is higher than the award that's in keeping with their level of experience and expertise. One of the most important things, I think, is having a group of people that you work with who you know are loyal to you and who you can show loyalty back to them. And that sort of plays out in two ways. One is in treating them with respect and in affording them the important things like leave and pay and, you know, being understanding if things crop up from time to time, and also providing them with adequate training. The other thing is ensure that if you are going to hire staff yourself, that you do conduct interviews so that you can actually gauge interpersonal skills that these people that are applying for your positions actually have. Talk to their referees so that you get an idea of how they've fared in their previous jobs, and make sure that when your staff members do start, that you do allocate time to train them up properly. It's very frightening for a staff member to come into a role and feel like they're expected to just pick up and run on their feet. So you need to train them up with whatever practice software you're using. And also to sort of train them up on how you'd like them to meet and greet your patients, answer the phone calls, how you'd like to have your billings done, etc. And then the other thing that I found very helpful throughout the years that I've been working in practice was actually to conduct regular, and I do it monthly now, just staff review sessions. We don't call it a review session, we just call it a meeting. And it's the best opportunity I've found that the staff have to actually express any problems that they might be running into with the way things are being run in the office. It allows you a point to check in and see if they're actually happy, and to change the things that you can change if, you know, they mention things that are maybe not that great. And, you know, it gives you an idea of how things are faring and just general job satisfaction. So there's sort of the take-home things with regards to setting up your practice that I wanted to share. Patrick, what about yourself? What pearls of wisdom have you got from your own experiences?
I wish I had all these pearls before I started. Oh, man, where were you guys when I started, Emily and Chris? So I'd like to echo what Marilyn said. You know what? One of the silver lining to this COVID-19 pandemic is the Zoom and the WebEx and all this meeting. We didn't have a lot of these meetings that Marilyn was talking about, but since this has started, I've been conducting weekly practice meetings. Our whole group gets together, talk about what's happened in the past week, and that way you get right on top of things. If there's issues, it's brought up. So that is important to keep track of what's happening in your practice. It is your practice after all. The other thing that I like to mention is everything about running a practice is adaptability, right? So you guys are all surgeons. You don't get to where you are now or become or soon to be surgeons without being able to adjust to changes. And there's no greater change than what's happening right now in our society, in our community. Every day it seems like it's a change. So if you can change, that augurs well for your practice. Just a very brief thing about my practice. I'm sort of lucky and unlucky because I straddle the old-fashioned bricks and mortar practice. Manager, secretary sits there, everything's done in the practice itself, to what's happening now, a lot of outsourcing of IT, outsourcing of typing. I started back in 2002 in a group practice, and I thought, oh, fantastic, everything's going to run smoothly for me. I've finished my training, all these patients got to come over to me, and I'll just operate. But it became very complex in a group practice because you got a lot of personalities, people wanting to do stuff, and you're not getting the right referrals. So the greatest thing ever was for me to listen to my greatest source of advice, my wife, the smartest woman on this planet, and said, okay, it's time to move away from all this group practice and let's stand on our own 2 feet, our own feet. And I started outsourcing all these things that Emily was talking about back in 2005. There was no outsourcing. So we had to find our own billing system, our own booking system, our own typists. We end up using commercial typists and then getting them involved in the medical side. But things change, so you must change. And we're surgeons, so we know how to operate, but we don't know all this other stuff, which is why asking for advice, both from people like Emily and from Chris, is absolutely vital. So there's no pearls of wisdom. The main thing is just adapt and be ready for change and listen to people who are closest to you. Please ask questions. You didn't come and become surgeons without asking these questions. So I think that's very important to remember.
Thanks very much, Patrick. So the second aspect that we just want to touch on and give you our perspectives on as well is the self-marketing, which you've heard Chris talk about, and I think it's a really important thing to appreciate at this point in your careers. And I didn't realise how important it was, and I was sort of, learning on the fly. But there's a couple of things that I think can make your life really a lot more streamlined. One is, in terms of marketing, utilise the resources of the people that you have around you. The business development managers at private hospitals will actually help to set up meetings with GPs. You make sure you take along a flyer, you know, your nice business cards. Be prepared to give a short, not a boring spiel, but just a short spiel on the focus areas of care that you offer. Just to sort of give everybody a perspective on how you can be a little bit different to the other person that came the week before. The other thing is, make sure that you get the right people to put the information that you want on your website. So use, you know, a proper website company. Get professional looking business cards. You know, looking the part is very, very important. You've got your fellowships. Now you've sort of got to be able to market yourself and be proud of the fellowship that you hold, and go out there and deliver the care that you've, you know, spent a decade or so preparing to deliver through your training. The other thing is, when the offer does come up, get involved in presentation nights for GPs, which a lot of hospitals run. It helps to publicise your presence in the community. The cautionary word here, however, is be wary of how you market yourself. And I think the how is the key here. Stay within the RACS guidelines for what's an expected standard for a fellow of RACS, okay? If you need further guidelines, check, you know, on the college website. You can even contact your fellowship coordinators. They'll send you logos and the approved paraphernalia that you are able to use on your websites and your business cards, etc. And then the other thing that I just want to very briefly touch on is, it happens to all of us, and it's very upsetting, but there will be patients who don't like the kind of care that we offer, who want a refund or who want to complain about us. It's a new feeling sometimes, because you've all gone through, you know, being pretty much unscathed and told how great you are, and all of a sudden you're trying to deliver the best type of care you have in the busy life that you lead, and people are unhappy. Well, my advice there is, be expected to have this type of thing happen, because the biggest thing is when you feel like it's never going to happen, and then it happens, and then you're sort of, you know, having to deal with it. But when, say, a patient sends in a complaint or wants a refund because they're not happy, make it a priority to sort it out ASAP. Don't let these issues linger, because they cause more problems in the long run, and patients get really annoyed that their complaint hasn't actually been attended to. And the longer you leave it, it's going to affect your mental psyche in how you function on a day-to-day basis, and it's going to affect how your staff function. So get onto it and make it a priority to deal with those issues. So Patrick, I just want to, throw to you.
I totally agree. I totally agree with that. Get on the front foot. As Chris said, you know, you got to be prepared for it. It's going to happen. So really get on the front foot and sort it out almost immediately, because it's going to dwell on you when you're operating as well. So if you're thinking about other things when you're operating, you're not going to have a good outcome. Just with the practice stuff, I forgot to mention, you got to remember your management staff is your engine room. Without them, there is no you. There's nothing being ordered, nothing being organized. So I hear this from a lot of my colleagues. We just don't thank our managers and our secretarial and our administration staff enough. Just thank them. You know, you're busy, but it's not hard to just go, oh, thanks for doing that. You know, it's not that hard. So that's another little pearl of advice that I have to give to you guys.
Thanks, Patrick. Yeah, absolutely. So we've got a couple of questions now for Chris and Emily. And I might start off, Emily, with the first one. So the question is, what are the legal liabilities if the outsourced personnel is complained about by a patient or a family member?
Thanks. So there's probably two elements to that question. One is the legal liabilities, but one is also just how do you deal with that situation. As you mentioned, making sure that you're getting on the front foot with any of those scenarios as they're coming through. The legal liabilities really is going to be covered in your service agreement. So the service agreement that you have with your outsourced provider should be very, very clear about what sort of liabilities sit with them, what sits with you, who indemnifies each other in different situations. So the legal side of it's going to be very well covered in the service agreement, and if you're reviewing that and you have questions about the specifics of that, you can obviously ask the provider or ask the lawyer that you're reviewing it with. From an actual day-to-day perspective, I would say that your outsourced team is still your team, and you should have regular open communication with them in the same way that you would have with staff in your rooms. And feel free also, Patrick, to pass on that same thanks to your outsourced administration as you might to someone in the team. So it's obviously lovely for everyone to feel appreciated. But it's also important to make sure that feedback gets back to people. So if there has been a complaint that's come through you, make sure you tell the service provider, you know, tell the manager that looks after your team or a person on your team so that they're aware. I would expect most service providers, you know, depending on what they're doing for you, it will offer to deal with that. I mean, that's a normal thing that we would do. We would, with your permission, contact the patient and, you know, try and resolve that situation as best as possible on your behalf or on our behalf. If it was actually really serious to the point that it became a legal thing, like someone was making a case against you and your practice, often your practice insurance will cover that. I mean, we at Hoxton have practice insurance to cover Hoxton for those sorts of things, and we obviously have really strict policies in place for our staff and our clients as well. But generally, I think if you deal with these things, you know, fairly quickly and fairly directly, and you speak to people as people, you can often resolve most of those situations before they get to a point where it's going to need that kind of legal level. And that's going to be whether you have outsourced staff or in-house staff. That kind of approach is usually going to help you prevent it getting to that case. But certainly all of that legal stuff is well and truly covered in your service agreement. And if it's not, maybe you should look for a provider that provides that level of you know, specificity in their agreement with you.
Thanks very much, Emily. The next question is, we've obviously got some plastic surgeons in our audience, and this question's to you, Chris. In terms of marketing, are plastic surgeons allowed to use before and after pictures to sell their surgery? And what are the rules around that? Could you make a comment, please?
Yes. Very, very, very easy to comment on that. The short answer is yes, you can use those. First of all, and may seem fairly obvious, but you've got to obviously get the consent of the patient that you're going to do that. And they clearly must be de-identified. So, you know, mask across the eyes or something along those lines where that patient can't be identified. So yes. Can you hear us, Marilyn?
Yep.
No, I've finished.
Okay, great. No worries. That's okay. I wasn't sure. I wasn't sure whether it was a pause or a finish. Okay. The next question I have is another one to you, Chris, and that is, do we need to get the patient's, two questions, do we need to get the patient's consent to share their clinical information with other specialists, number one? And number two, is there a stepwise process in how, well, actually, in how to deal with if a patient goes and complains to APRA? Like, what should the surgeon do?
Okay. So in relation to the first question, so I've forgotten what was the first question again?
Yeah, so the first question is, you need to get the patient's consent to share their clinical information with other specialists.
Yep. The answer to that is no, because privacy rules are you collecting information for the purpose that it's used used for. That's why it's been collected. So if you're collecting medical information for a patient and you're referring it or seeking further information from another clinician, then that is the reason you've purposely collected it, and it's okay to share that information with another clinician.
Okay, great, thanks.
Yeah.
What about if a patient complains to AHPRA? What is there steps that the surgeon needs to take?
Just call the MDO. First of all, don't sit on it, because some unfortunately go, well, that's rubbish, that's frivolous, I'm just going to put that in the bin. Do not do that. Don't contact the patient directly. First rule, do not contact the patient directly. Contact your MDO, because that's covered by, as far as I'm concerned, all the MDOs. It's a standard coverage under the policy.
Thanks very much, Chris. So that's at the end of our Q&A session for this webinar. I'd like to thank Emily and Chris for giving up their time and for sharing their wonderful expertise in practice administration and medical marketing. So thank you, both of you.
Sorry, Marilyn, just if I can interrupt, there seems to be another question come up. There seems to be another question that's popped up here from a orthopaedic surgeon. Sorry to interrupt there.
Yep. Okay. Yeah. So the question, the final question for tonight is: can you put up de-identified X-rays from an orthopaedic perspective on the websites? You know, for before and after alignments, etc.
It'd be the same rules and my commentary with regards to the cosmetic surgeon. If de-identified as indicated, but also again with the patient's consent.
Okay, great. Thanks, Chris. Patrick, did you want to add any final comments before we close the session today?
Oh, no. Just thank you, Emily and Chris, again. Very, very informative talk. Really enjoyed it. Just for the attendees, just please keep sending questions in. What we'll do is we'll send these questions to Emily and Chris directly, and then the answers will be on our website. Right? So if you come up with some ideas, some questions, please keep sending them in to us, and we'll forward it to Emily and Chris.
Thanks, Patrick. So the next session is actually next Tuesday at 7 p.m. So tune in to get your dose of the do's and don'ts of medical billings. Now, this is the first year, as you know, that we've actually run the Preparation for Practice webinar sessions, and we're really interested to know your feedback, and we'd love to get that. And the best way to do that is to complete the feedback survey after each webinar, so that we actually know how to improve things for you for the future. So thank you all for joining us. Thanks particularly to Virginia and Catherine from the College of Surgeons for all the behind the scenes work that makes these webinars run smoothly. Thank you to Patrick, and thanks again to Emily and Chris, and have a good night, everyone.
Thank you.